Yes, I drink cool. I cool water. I cool water. I like water. Stay cool. Yes, I drink cool. I cool water. I cool water for life.
I cool water for life. Lady Elisa, I want to tell you. You know, I'm just, you listening to the news just now, and I was just fascinated by all the things that I hear. You know, I'm thinking, what is it? Legionary bacteria, is that a thing happening in the Cayman Islands right now?
Yes, that's something that we just heard in the news. I want to welcome everybody to the breakfast hour. Of course, we are having a conversation about the news because we have been online from 6:30 this morning on www.flashpointmedia.ky, and so we have discovered that Legionnaire's disease is something that was mentioned in the news today. They had a case or two here in the Cayman Islands. But
all right, fine. Legionary bacteria disease. It says not so,
yes,
and it's linked to some water supply thing.
apparently it has. So we got to get some more information.
Is it by bathing in the water though? Is it that you bathe in the water and it happens, or you have to drink the water? All right, well, we don't have information, so let's leave that right there. Remember, most persons drink bottled water anyhow, so I don't think they're going to get it. And if you're getting it, then we have to question the idea of something else. All right, let's look at one more thing. One more thing. Farming in Cayman. You know, all right, fine. Let's go to our hearing that is laid to rest for women's rights in the Cayman Islands.
Yes, Miss Francine Jackson, the body
right.
will be lying in state today.
Yes, so we want to, yes.
So we want to be up there, actually. We want to actually, you know.
Yeah, we definitely must be a part of the ceremony and, of course, participate in actually capturing this information and taking it back to the people, talk about it a little bit. So we want to big up women's rights. One more thing on the women's rights, part of it is women are now leading the charge in farming, and we are encouraging more women to get in farming. Yeah.
Yes.
We're going to have this thing down to T. These guys are worthless, you know. We don't have much men who are going to lead anything these days. You're going to be doing nothing. You're going to be also helpers.
It's a teamwork. It's a teamwork.
No, it's not teamwork. Don't come with a teamwork story now. It's the women leading the charge and they're going to be doing it. And I'm saying I'm happy that the women are starting to decide that they're going to take over from these men who are not doing very well. You know, you have a lot of buildings to build and constructions to do. These guys need to go home and stay home and put on the apron, man. Sure. Women are taking this thing to another level. You know, we have some real creative women. And I'm not going to go with the idea that we don't. We do. But as I see the farming industry is being taken over by the women, and the men, it didn't seem that they were doing a good job. I don't hear much rights about men rights and stuff like that. So I don't know. Let's get into the news, I think.
You know, there are some things, Michael G, that go without saying.
What goes without saying? Men don't have any rights. That's what I'm saying.
No, we know the men are already doing their thing.
That's what I'm saying. So there's no men's rights. So men can be treated no, there's no such thing as a men's right. Yeah, have you ever heard a men's rights platform where men are having rights or
right here at Flashpoint?
Men's rights.
No, it's
all right. Let me go with this one. I want to say that it's a false and a fool's day to say that women are treated or less treated in the society, because women are the most highly treated in any society at all right now, especially in the West, where women are at the top of the game and top of everything, and then still saying they still are under the foot of men and stuff like that. It's just kind of troubling, you know. You get it? Yeah, I want to just leave it there. All right, it's a hard sell, but yeah. All right, I'm gonna do it. All right, so I'm gonna celebrate the women who are going to be farming, and guys, look out for more food. The women are going to be doing it this time. You're not going to be doing well. I'm looking forward for it. I want. My father's a farmer. You know, my father's a farmer. He taught me how to do farming and stuff like that. It's hard work. Hey, this farming thing is not a simple job. But I guess if you're going to do it in the 21st century, it's not going to be so hard because you have tractors and stuff that can do it and machine that plant them. Not in the old days when the men had to dig the fur and park it up and do all that nonsense. Easier. Ladies, let's get into it. We're ready.
Shout out to all the farmers. Shout out to all the farmers.
All our female farmers who are taking charge.
And the members of ASI came and who have launched their own podcast. Let's Farm Cayman. And of course, the idea behind that is.
But I think that's a husband and a wife that is doing that farming. Let's Farm Cayman.
The idea is to get men and
husbands and wives don't do anything anymore. It's just women versus men, that kind of thing.
You know what? It's wellness time. It's time to hear from Dr. K. Thank you very much.
Thank you very much, Lady Elise. Of course, this morning it's all Wellness Wednesday right here on Flashpoint Radio FM. Of course, on Flashpoint Media right in the Grand Cayman Islands. I know, Lady Elise. I'm sorry. I had to talk about that a little bit because sometimes we separate so much that we become irrelevant in every effort because we have been. It's like a scorpion. Have you ever seen a scorpion sting itself? I don't know what I'm saying. Of course, welcome to the breakfast. Dr. K. Of course, welcome to the breakfast hour. And of course, another Wellness Wednesday right here on Flashpoint. Of course, those who are listening to us on www.flashpointmedia.ky. Of course, you can log on to our YouTube and our Facebook at Flashpoint Media. That's it. All right? Don't need to do anything else. But if you go to flashpointmedia.ky, then you just simply branch into all our social media platforms. You don't have to go searching, typing in anything. Go one place. It's a one-stop shop. Of course, we are Wellness Wednesday today. And of course, for me, I'm bursting with questions already. Some of them I can't even start.
I won't let you burst on air. I'm just going to start by asking the first question that I have here. What are the most important screenings or tests people should have at different stages of life?
Okay, so that's a good question. And screenings actually start early. So from you're born, you're screened. So a baby that is just born, and depending on the situation with the pregnancy, they may be screened for different things. Mm-hmm. So we know that sometimes babies are born and they're screened for, especially in the Caribbean where we have a black population, the first thing that they do is they get their cord blood. That is from the umbilical cord, and they're screened for genetic disorders like sickle cell disease. So just about, I'm not sure if it's the entire hospitals in Jamaica, but I know that at the University Hospital, that's one of the tests that's done on the cord blood. Okay, because the sickle cell unit is there, so they screen for sickle cell disease. And sometimes they screen for other genetic disease. In the United States, they screen, especially if you have a family history of, say, celiac disease or other diseases, you're screened. The cord blood is screened. The other thing that happens is that they're screened for jaundice. So your baby comes in, and sometimes, depending on what's happening, they could be screened for lots of different diseases. Trisomy 21, which is Downs. They could be screened for any other genetic disorders. So, yes, from day one, they're screened. From day one. In fact, sometimes before even
From day zero.
From day zero, because they're screened intrapartum. The
Yes.
mother is screened depending on, especially if she's a elderly primigravida, or she is you call it pregnancy in old
You have
age,
to
and that
break.
is
You have to break that one down, Dr. K. An elderly,
primigravida. A woman,
elderly and pregnancy go along one sentence.
yeah,
That's
but
what
actually,
every pretty gravel law.
for example, a woman who, even if it's her first pregnancy after 35, or even subsequent pregnancy after 35, because after 35, they're thinking that your risk increase. So the risk increase for birth defects, for different things, especially Down syndrome and other things with the baby. So a woman will be screened at that age if she's pregnant after 35 for problems occurring with the baby.
Wow.
So, right. So in pregnancy, you're screened. So the baby, before the baby is even born, the child is screened. So we go through that. But even after your child is born, there may be screening. You do your hemoglobin, your white blood cell count, just to check, just to have a baseline. And then you may not get screened probably later on in life when you become a teenager. Your doctor might just do just regular screen, check your cholesterol, check your lipid level, check your hemoglobin again, just to make sure your platelets and everything. This might not be done once a year, this could be done every 2 years, but these are screening tests. When you get older into your 20s, you do get these tests done again, just to make sure that everything is on track. Your HbA1c, looking for your glucose control, looking for making sure that your lipids, your cholesterol, and everything is okay. Your platelets is fine, your hemoglobin is fine, your white blood cell is fine, and there's nothing happened there. And that's just a basic screen. When you get older, so you get into your 30s, they continue the screen. But by the time you reach 40s, then you have a lot more screen going on. So by the time you reach 40s, if you're a man, they might want to do a basic PSA level just to make sure that your prostate is okay. They might want to do just regular bloods again with just checking your cholesterol and everything else. A woman at that time, depending on her family history, and then for a man, depending on his family history, he might get it earlier than 30, than 40, could even 35, because if he has a relative with prostate cancer, an immediate relative, whether it's going to be a sibling or it's going to be a dad, then he would want to get screened earlier. A woman, she's going to get her mammogram, okay? And a woman who is sexually active, from the moment she gets screened, so she starts getting her pap smears from early in life. So for
the woman, as you mentioned, that the pap smear begins not at a particular age, then, but it would be when their sexual activity. So after sexual activity, then there is regular screening with your pap smear. But if you have never been sexually active, is it something that a woman should consider doing? Say you're 40 and you have never been sexually active. Do you still need a pap smear?
So a woman who is 40, who is never sexually active, we're looking for HPV. And HPV is only had during sexual activity. So a woman who has never been sexually active is unlikely to get cervical cancer, because HPV is what causes it. So she has to get it from somebody. And since nothing has ever been there, then it's unlikely. But what she can do is probably get ultrasounds just to check her pelvic structure. So she probably wouldn't get a pap smear, but she would get an ultrasound to check her pelvic structure. Right? We try not to do pap smears in women who have never been sexually active.
Okay. What about for the breast? You mentioned the mammogram, and of course, I think there are different ages. Some persons say 38, some say 40. The start of your mammogram. And once you start having mammograms, how often do you need to have them?
Okay, so if you are having mammograms at that early stage and that's nothing happening, you can go every 2 years just to screen. Once you get older, you tend to go every year, but initially you don't need to screen. You don't need to screen every year.
Well, here's where I go earlier is when
But it all depends. Hold on. If you have a family history, then yes, you will go on with your screening yearly.
But I would go back. I would go back to when you started off at childbearing and the defects that can take place with late pregnancies. Why? I'm trying to keep a straight face on this one, but the truth is, it's a real question. It is very important. Is it recommended, though, that women do have pregnancies at these late stages in their lives?
You know, I mean, Mikey G, that's a personal thing because I can't say it's recommended or not recommended. It's a personal thing because a woman, you know, she's been trying to get pregnant for 10, 15, 20 years. And when she becomes 41 is when she gets pregnant. So, and then, you know, that's her first pregnancy. She's 41 years old. The truth is that there is a peak time for child rearing, but it doesn't mean that when you're 40s, you cannot have an awesome baby.
For the benefits of the listener, what are those peak times for child rearing or having birth, starting having children? Are those periods where you should be considered the best time to have children? If a man wants to get married and he decides to have children and he wants to pick a very fertile time to have the best child that he can, bouncing baby girl or boy, what's the best time for that?
And we always recommend your 20s, but then remember that different women mature at different times. So a 20-year-old woman might not be the same as another 20-year-old woman. A 20-year-old woman could be very childish because her body is not fully there, and there's a 20-year-old woman, man, she's full. So it all depends on the person.
Yeah.
So the ages will 20s, in the 20s, like 20 years of age to what cutoff point?
I mean, usually
35.
Yeah.
She said 35 is elderly.
You have the risk, so right there.
Higher risk.
So you're looking at stopping having children. You're supposed to stop trying to have children at 35, not trying to get pregnant.
Yeah, but it's not always possible, Mikey.
No, what I wanted to do with that was just to make clear that it's not a case where you are having problems to have children. You don't do everything else, and then at 35, you're now busy trying to get children. You should be trying to get children before 35, that when 35 comes, you don't want to be trying so hard. But if you're having a problem, like you're having a real situation, then, oh my God, it is unlikely that God would just not bless you like a Sarah. You know, a Sarah exists every time somewhere, but you can't make yourself a Sarah by deliberate means, you know? And that's what I would want to say.
And the thing about it, Mikey G, is that women who are having children early, say, for example, even early 20s, can have birth defects.
No, I'm not talking about the birth defects that they can have, because what I would say, Doc, is that sin is a factor. Sin is a factor. And I've seen so many people who wants to use the most defective thing to say that because I am like this, I am perfect this way. Yes, you are perfect in God's sight, but God forbid, man. You know that this is not how God would intend you to be. I mean, I was born crippled and I didn't have any eyesight. Now, I was not born with all the attributes that I was supposed to be born with. So I came out a little bit not having all the things together. But that don't mean that I'm not a real person and God don't love me and people don't love me. But do not go around telling people that I am the same as the rest of persons, because I'm going to need some braille to work with because I can't see, or I'm going to need to listen more than I talk, right? Because I can't see, and all of these things. But we want to make sure that we do not create the what you call the defects for ourselves mentally first, without we having them by birth, you know? And this is what I wanted to learn that.
And of course, I have another question, Dr. K. It's connected to what you have been discussing so far. And one of our VIP members would ask, can a doctor describe sexually active? Because I think we, in relation to when you're doing your pap smear.
Like when the mothers carry the daughters to the doctor and say, check her and see if she's having any form of interaction with anybody, doctor. Take her, let me know right now.
And that's really not a good thing, to take your daughter to the doctor and say, can you check to see if she's sexually active? That's terrible. You shouldn't do that. Nobody should do that. Ask her. Speak to the person. Don't take her to the doctor to find out if she's sexually active. However, if you examine somebody, you can know that this person is sexually active or not, or this person has been sexually active. But that's not a good thing to do. Never take your child to the doctor to say, doctor, can you check this child if she's sexually active? The one thing the doctor is going to look for is the hymen. And if the hymen is not there, does it mean that the child is sexually active? No, because there are other things that can cause a child to lose her hymen. So you cannot say the absence of a hymen means sexual activity. It's likely, but you cannot confirm that it is.
So to the question, what would you consider sexual activity then?
You mean you're talking about examining a person to say they have been?
No. This is, I think the question is, can the doctor describe sexually active? And I think it's based on the question that we had earlier about doing a pap smear, and if you have never had sex, never been sexually active.
But the doctor doesn't look to see if you're sexually active. The doctor asks you if you're sexually active, and if you say yes, then they will do the pap smear. If they say no, then they're not going to do the pap smear.
Right. And
it doesn't matter. I remember having a child many years ago. There was this young girl. I mean, she was probably, I don't know if she was 15, and she came to the hospital because she was bleeding a lot. And the private doctor sent her to the hospital because she was basically hemorrhaging. And she came to me, and young girl, very slim, and she was bleeding, and I was there. There's no way she could be having her periods at that age for her to be bleeding so much that she was pale like a sheet. She was definitely hemorrhaging. And I said to her, are you sexually active? And she said, no, she's not. But I didn't believe her. So I asked the nurse to give me the whole speculum set. And they were like, no, you can't do a vaginal examination on this patient because she's not sexually active. I said, but I don't believe that she's not sexually active. Anyway, I went to her and I said, you need to tell me the truth, because today you're going to die. And if you die, and if you don't tell me the truth, you're gonna die, and there's nothing I can do. So you can't blame me if you die and don't tell me the truth. And she said, yes, I'm sexually active. But at the time I knew based on her symptoms. You know, the thing about it, people, it's hard to lie to your doctor. Your doctor will just look at you because what you're saying don't add up. And they're smiling their side because they're saying, why is this person lying to me?
Like parents, doc.
Like your parents. You're lying to your parents and they know you're lying to them and they're waiting for the truth. So you go to your doctor and you're telling them giving them a story, and your story don't add up. I remember another patient came to me. I mean, it was in an open emergency room, and I said, he came in and I said, how can I help? He said he's diabetic. I said, you're diabetic? He said, yes. I was a young doctor then. And I said, so what are you taking? Are you taking pills or insulin? He says, I don't know. So I said, where's the medication? He left it in the car. So I said, something is wrong with this man. So I went to another senior doctor and I said, something is wrong with this man. He's not telling me the truth. I don't know why he's here because I can't help him. And she said, take him in a private room and talk to him. And when I did, he was HIV positive.
Wow.
So sometimes sometimes the patients will come to you and they tell you different things. a patient comes in and the nurse is screening her, and she said she has chest pain. And the nurse said to her, "Are you sure you have chest pain?" And she said, "Yes, she has chest pain." And the nurse said, "If you tell the doctor you have chest pain, do you know your doctor is going to charge you so much money? They're going to do an EKG, they're going to do labs, they're going to do everything. So what is the real story? Are you really having chest pain, or there's something else happening to her?" She said, "I want to talk to the doctor." I said, "Okay, that's fine." She came and she spoke to the doctor. She was having problems with her boyfriend, and she left the house to come to the hospital. But to be seen quickly, chest pains will always be seen.
Yes.
So,
But do not lie to your doctor, right?
yeah, quickly. If you are telling me you have chest pain, you'll be seen quickly. Unlike this man who's been having chest pain.
Go ahead, sir. Go ahead.
Unlike this man who's been having chest pain for 3 days, came to the
Yes.
hospital, barely coming to the hospital Monday morning. And I said, "Sir, what has been happening to you?" He said, "My stomach hurting me." I said, "Your stomach," and he's been drinking milk because his girlfriend has been giving him milk all weekend, because his stomach is hurting him. I look at him, he was so sick, diaphoretic. I told the nurse, I said, "Sir, show me your chest." And he showed me his stomach, and he said, my stomach. I said, "Oh God, this man is having a heart attack."
Yeah.
40-year-old died on me within 15 minutes.
Wow.
Has been having a chest pain. And
Drinking
he said,
milk.
because if you say your stomach is hurting you, nobody's going to be looking at your chest. And so,
Right.
because this is his stomach, he ended up not getting the care that he needed. And by the time he reached the hospital, the horse had gone through the gate. He had 100% occlusion of his coronary arteries.
Mm-mm.
And coming in just a day earlier would have sent him to the cath lab, and this man would be able to live. So, she's coming in with a different story where she has no chest pain, and this man who had chest pain, and because he was complaining of a different part of his body, he didn't get the care he needed and lost his life. So yes, sexual activity, we can determine sexual activity, because remember, a doctor is trained, and especially children who are probably having some trauma to the vagina, whether it's sexual abuse or stuff. We try, even those kids, we don't just go ahead and examine them. We try to do them under anesthesia. So you sedate the child a little bit to examine the child, because it's a very traumatic experience.
Very traumatic. And of course,
you don't go through and just examine a person just to look for sexual activity. It's not a very pleasant experience.
and of course, our viewer, our listener is just clarifying. She's saying, do you have to be having sex daily, monthly, or yearly to be considered sexually active?
Well, sexually active means that you're actually, it doesn't have to be daily, it could be monthly, it could be weekly, but at this period of time within this year, you've been having sexual activity. So if you used to, for example, I might have an 80-year-old, and I said, "Are you sexually active?" And she said no. She hasn't had sex since her husband died 20 years ago, or 10 years ago, or 5 years ago. She's not sexually active at this time. But I go to my 70-year-old, and there, oh my Lord, she's having sex. I mean, it might not be every day. It might be once a week, it could be once a month, but she's still sexually active at this time. Because the point is that she could have had sex yesterday, and the last time she had it was three months ago. So yes, or a month ago. But at this period of time, are you having sexual activity? So it doesn't have to be every day, it doesn't have to be every week, but over a period of time, are you having sex?
And then that will qualify you for your pap smear.
I'm sexually active. It doesn't have to be every day, but I'm sexually active at this time.
Okay. All right.
So let me ask a quick question. So for like husbands and wives who lives apart, for like one person work away and they come, they be home in every 6 months, every 3 months, or 6 months. So
sexually active.
So every 6 months, the husband or wife might be home, and they make contact. How do you treat that? You consider them sexually active as well?
Yes, they're sexually active. Yes.
6 months apart.
Yes, sexual activity doesn't mean that you don't have sex once in a while. It doesn't matter whether you're having it once in a while, every day, 3 times a day, 5 times a day, or even every week. As long as you're having sex in a particular time, within a year, you're having sex 1 or 2 times, you're still sexually active.
Okay. I just want to clarify, yes, and the factor of the aged person who would of course be having sex once in a while and probably, you know, be counted out a little bit. I am not sure if that would be the case.
You're not counted out. You're not counted out.
Okay.
And, you know, I must sort of not balance, but I asked about the females who, you know, as early as sexual activity begins, you're thinking about pap smear, and then at age 40, you're thinking about mammograms. But for the young men, after their parents would have been carrying them to the doctor, maybe for their annual, maybe they have medical that they need to go to school, but after that they don't feel that there is any need ever to see a doctor again in their entire lives until they are 40.
Why do you speak with such scorn of the young men who just look as if they don't want to see the doctor? As
Sorry let me retract it. So,
especially if we're going to go to see a male doctor, right? The doctor is male, right? And we don't want to see a man looking at us, really. I mean, and it's a true thing, you know. So I would say, whenever my mother want to get me to a doctor, take me to the pretty doctor. Take me to the pretty doctor, right? So when I realized that there was also women who were doctors, take me to the pretty doctor, all right? Because that's the one I want to look. I don't want that man's touch on my skin. I don't want to feel a man touching me, you know. So I was very skeptical about doctors and stuff. So yeah, for me, I don't know if it is a thing anymore because since as everybody has become more liberal about the thing, but I would say that this was something that caused me as a young man who never wanted to go to the doctor a lot because I didn't want to see a man touching me, especially when we talked about prostate issues and all these things. I remember taking my father to the university hospital to do a prostate examination, and then all I could see is this man putting on his gloves and clicking it, plap, plap, and then going inside the room. I'm like, and then I didn't even understand what the examination was. But then God Almighty, man, come on. Couldn't there be a woman who actually come and actually did the examination? Could you have women doctors and quite a few male doctors who are volunteering for this procedure? I'm getting my mind a little bit easy right here. So I'm gone. I'm not coming to the doctor. I am not coming to the doctor.
I asked Dr. K a question and I'm lost.
Mikey G.
Yes, ma'am.
And you know, you're one of those patients. I'm telling you. Do you know that medicine is a historically patriarchal specialty?
No, I'm certain of it.
Do you know that medicine
I'm certain of it.
Historically patriarchal? So in your father's time, do you think there were female urologists?
No, I'm saying to you.
Do you think there was none? There was probably one. There was no female urologist. So the person who would be seeing your dad as a urologist would have been a man. So now you would have had more female doctors over the past few years or over the last 20, 30 years. You have a lot more female doctors.
Well, that's what I was saying. There were female doctors when my dad was doing the thing.
Yes, but then they might not have been the specialty that he wanted. So I mean, if it's a general practitioner, yes, but as a urologist who will be probably specializing in male health, there might not have been. Unfortunately, coming back to 2024, you have a plethora of female doctors.
Well, we are grateful.
I don't have a problem with you saying that, but I'm just saying, you know, I've had patients come in and they get a male ultrasonographer to do say a prostate ultrasound and they're upset, you know, and the truth is that there might not have been a female, but if you needed a female, that you ask for a female. Or for example, a woman who wants to get an ultrasound done and or and it's a male, we try, I mean, in you try to accommodate. For example, if it's a case where it's a pelvic ultrasound, you try to get a woman. But sometimes it all depends on your facility. You may not have, I mean, you don't want to schedule a pelvic ultrasound with a male, but an abdominal ultrasound you might schedule with a male.
And that's not an excuse, Mikey G. The question is,
Yes.
a young man would have been taken to the doctor by his mom all his life, and then now he has graduated university and he's gotten his job. He does not feel the need to visit a physician. Now he doesn't have to be taken. He can choose whatever, a beautiful female or a male or whichever doctor. So the question is, should you, I know the women have routine medical examinations that we are required as, in life, and we do generally fulfill these requirements. But for the man, speaking about screening and health care, what would you recommend, Dr. K? Without the excuse that Mikey G gives, what would you recommend for men?
A young 20-year-old gentleman who is just starting his career, just graduated from university, then he needs to go to the doctor because he needs to get his basic labs. So what you do is that he might not get a PSA or even his testosterone levels, because those are supposed to be high. But he's supposed to be talking, or PSA is supposed to be normal, his testosterone level is supposed to be okay. But he needs to get his basic labs done. Check his cholesterol, check his hemoglobin A1C, get his thyroid checked, just get his usual metabolic functions and his baseline for him. If he's having an issue, and he may not be having an issue, but you might have a baseline, talk to his doctor. The doctor might say to you, just to examine his male organs, just to make sure that they're fine. Some people may have an undescended testis, and they may have gone unnoticed for the entire time. So your doctor will check. Your doctor will also check your penis, because there are some men who will have problems with their entire penile structure. So sometimes sexual activity might be a problem for them based on the anatomy of their genitalia. So yes, your doctor will check on you to make sure. So it's just making sure that your basic function, even your sexual function, will be optimal. And you don't know, but your doctor will tell you, oh, this is happening. So you might not get a prostate examination at that time, because it doesn't warrant, as I've said before, your prostate enlarges with age. A 20-year-old is not supposed to have, or 25 or 30-year-old is not supposed to have an enlarged prostate. So your prostate enlarges with age, but you're sensitized to the fact that you need to get these tests later on in life, and you have a discussion with your doctor. Later on, when you're older, they might want to do a PSA, probably when you're 30, 35. They might want to do a PSA on you as a baseline, but they might not do a rectal examination or even a prostate ultrasound at that time, because it's not warranted at that age. Yes, sir.
If you're just joining us, you are here and you're at Wellness Wednesday, and we're asking Dr. K some medical questions. And listen, I had like 4 questions, and we are just on question 1. We will have to continue to part 2, but I am going to say, I have a question, but of course, he had his hand up first.
Number 1 question is this one. Here's a question for Dr. K this morning. And of course, we're talking about prostate and men's health. And of course, here's the option number 2 that men always choose. We rather die You know, but yeah, no, I'm telling you, it's a choice. But here's the thing: I'm gonna
And
ask.
that's true. I've seen it. I've seen
It's a
it.
true statement. I'd rather die. That's a true statement. So here's the question I want to ask, Doc. Not the rather die part, because of course, you know, we are here for the long haul, right? How do men quickly identify that they are having a prostate issue, and to then visit their doctor if they're not prone to wanting to visit doctor? But this is an unusual activity that happens. How would you just an activity that would cause you to then get question in your mind that maybe there's something going on that I might need to check out? How would you
Your stream. When
Not your internet stream, not how
your PP stream.
Okay.
Your urination. I'm serious. A man who has a good prostate, he will be shooting over the fence. When a child is young and you see them pee, the pee shoot up into the ear and over the fence. A young man who pees, his pee shoots all the way to the neighbor's house. When they get older, their pee is not as strong. And it's a normal thing for it to be not as strong, but it still shoots out. Now, the moment you're dribbling and the pee is the stream is not as strong, it's time to go to your doctor to say, hey, you know, I usually pee and it's strong, but now it just a dribble out. It just dripping out. That's something is wrong. And don't wait until it dripping. Once you find out that the stream is a little slower, yes, have a conversation. Don't wait until it starts to drip like a pipe that you leave on, because that timing horse has gone through the gate, people. It's preventative, not treated. Preventative. We don't want to be retroactive, we want to be proactive.
It's preventative, not the other way around. You know, your internet stream thing, Lady Elisa. It's not the internet stream, guys. It's not the internet stream. It's a once. If you want to know if your prostate is having a problem, is when the stream needs to be cut. You know, and as the brilliant Lady Elise would ask the question, I would suggest, Mikey G, it's not your internet stream. All right, gentlemen. You know, if you go to the doctor and you see a lady sitting beside you and she come and you're doing a prostate examination, okay, all right, it's your wife, all right.
You know, Michael G, this was a very interesting discussion with Dr. K this morning, and certainly we have to have a part 2, because these are just a few questions that we shared, and there are still more questions.
More questions than answers.
Still more questions. So I just want to thank the viewers for sending the messages, sending the questions to us, because then that helped us to be able to prepare for this study, this stream.
Not the internet stream. The internet stream, but not the urination stream.
Yes.
It can get confusing sometimes, you know, Lady Elise. Like I just said a while ago, if you go to the doctor to do your prostate and you see a woman in the room and they're not your wife or wives, guys, who are they? Why are these women here? You know, you must question. I don't think people question these things anymore, because I think, anyways, you know, thank you guys for joining us this morning for this morning's episode of the Breakfast Hour. Anything you want to share with our listeners before we jump out of the studio this morning?
I just want to share that Conversations with Mario
After Dark
this evening at 10 p.m. You don't want to miss that. Just log on www.flashpointmedia.ky and you will be right there to enjoy the conversation. A lot more happening. Join us on the Breakfast Hour. It's all about our community day and so much more. And more. www.flashpointmedia.ky right here in the Grand Cayman. I'm going to just
put the promo up on Lady Elise before we jump out for a conversation after dark this morning.
When the world quiets down and the noise of the day fades away, that's when the real conversations begin. The ones we hide, the ones we fear, the ones that need to be heard. Conversations After Dark with Mario, where the silence ends and truth begins. Every Wednesday night at 10 p.m., Mario takes you on a journey through the real, raw, and rarely spoken truths that shape our lives. From personal battles to family struggles, community wounds to silent traumas. No topic is too taboo, no story too deep. It's not just talk, it's healing. This is a space where shame is shattered, silence is broken, and truth finally speaks. Conversations After Dark with Mario, every Wednesday at 10 p.m. only on Flashpoint Radio, www.flashpointmedia.ky. Stay up, speak up, heal forward.
Of course, I want to say catch you tomorrow morning, same time, same place. We're going to do it all over again for you right here on Flashpoint Media, Flashpoint Radio FM, all running at the same time right here in the Grand K. Guys, we had a wonderful time this morning. I hope you did too with us. And of course, each morning, each Wednesday, Dr. K comes to present. Of course, next week we're going to have quite a few interesting topics, a topic to talk about. Stay tuned. Much more to come. Tomorrow is our community guest day. Tonight, conversation after dark with the man himself, Mario, and that starts at 10 in the p.m. Sensitive conversation. If you're not adult enough or if you have small mind, please don't join the conversation. Alright guys, that's all for now. Of course, on behalf of myself, Lady Elise, Mikey G, I'm Lady Elise, and of course Corey Karen, our news anchor this morning. I want to say thank you very much. Of course, our Flashpoint team right here at Flashpoint Media. I want to say also a big shout out to our many participants, our VIP members, our listeners, our viewers. Have yourself a wonderful day. Flashpoint Radio FM right here in the Grand K. www.flashpointmedia.ky. And of course, go ahead and download our radio app and enjoy Flashpoint and take Flashpoint with you everywhere you go.